Do you suffer from breathing issues or indigestion and reflux? I'm Dr. Kez, Doctor of Chiropractic, and I'm going to take you through a great tip to be able to ease that problem. Did you know that a tight diaphragm, our muscle of breathing, which lives underneath our rib cage, when it's tight, it can significantly impact the ability of the stomach and the esophageal sphincter to prevent reflux from going back and forth in into our esophagus, which is not designed to take that acidic material. So what we're going to show you is how to release the tension in the diaphragm, because inside the diaphragm is a little hole called a crux. It's meant to be there. That's so that the blood can go down and the used blood can come back up to the lungs and the heart, and also so that your food can get down into your digestive system. It's meant to be there, but when our diaphragm is in spasm, it opens widely and our stomach can slide all the way up and have a party with our heart and lungs. Not something that is pleasant to experience. And of course, then the refluxy acidic material will pop up through the esophagus and you'll end up with all these discomfort, particularly if you eat late at night and then go and lay down soon after that. So what we're going to show you is how to release the tension in that diaphragm so that you can get rid of that terrible reflux and the terrible issues with breathing that happens when your stomach is sitting up and right in the middle of your diaphragm. Not a good thing to do. All right, now I'm Dr. Kez. I'm going to show you how I do this in clinical practice, and then we're going to show you how you can do this at home. All right, I have my wonderful patient here. Her rib line is through here, which you can feel just by running your hands down. You'll find that all of a sudden it goes from bony to soft, which is our abdomen. And I'm going to tuck my thumbs up and underneath so that I can massage the diaphragm, which will help to release the tension in that muscle. Now, this can come from another number of causes. If you have issues with anxiety where you start to breathe at a really rapid pace, it can affect your diaphragm going into spasm. If you suddenly suffer a fright of some sort, watching a scary movie or something happens in the family that creates a bit of stress and tension, your diaphragm can go into spasm. If you nearly miss the end of the step when you're walking down, suddenly take a big breath in, come on, we've all done it, that can also cause a spasm in the diaphragm. So working on that muscle like this will assist to ease the tension. I then check whether or not the patient's stomach has gone up towards the thorax or up into the heart and lung area, and we just gently bring that down to make sure that it sits back where it needs to. Now, one tip that I always give my patients after doing this treatment is please don't overfill your stomach for 48 hours. So no big volumes of drinking, no big food volumes, because otherwise we'll fill the stomach and it'll slide straight back up. We want to give the diaphragm a bit of a chance to go back to its normal capacity. Now let's sit up and we'll show these folks how to do this at home. Now, obviously, you're not qualified as a chiropractor, so certain things that we don't do at home, but this is a technique that is just like massaging your diaphragm. Pretty simple to do. We're going to use your fingers. I'm going to do it on yourself so that you can gauge how much discomfort you're feeling. For some people that suffer from lots and lots of anxiety, this can be quite tense and tense. Like if you're a runner, for example, and you're using your diaphragm all the time, that muscle, just like your leg muscles when you go for a run, when you go to get them massaged, can be a little bit uncomfortable. So just with intolerance is really important. So sliding our fingers down where the ribs finish and up and into the soft part, which is your abdomen, we're going to hook them up and underneath like that, and then take a deep breath in, leaning our whole body back. And then as you breathe out, allow your body to fold over your hands, breathing out, and you will find that your hands will be pushed up and into that area where the diaphragm is. Take another deep breath in, maybe slide your hands slightly further out laterally, and do it again. Breathe and dig in, and you will find that the very pressure of your hands being pushed by your legs back up and into your diaphragm will give it a really good massage. Keep moving your hands out till you get to sort of the side of your body, and then you can start again from the middle. Normally the middle to halfway across is where you find the most discomfort in the diaphragm. This is a brilliant way to release tension in your diaphragm. So like I said, if you're someone that suffers from anxiety, if you're someone that does a lot of breathing in and out, so exercise and running, it's important to massage this muscle just like you would any other muscle of your body to keep it nice and supple. Doing this technique will release the tension in the diaphragm, allowing the crux to go back to the way that it was, so that we don't end up having this reflux problem happening in your body. Super, super simple. If you don't want to do this yourself, find a chiropractor that does. Just letting you know, not all chiros do this technique, so you will have to ask if they do a diaphragm release. So that is how you sort out issues with reflux. I can tell you the treatments that I've done on patients have made such a difference to this particular condition, which means they can throw away the medication that's been causing them or that they've been needing to take to try and resolve this condition, because putting things in your body that dampen the acidic reflex in your stomach can affect your digestion quite significantly. So if you're popping quickies and things like that on a regular basis, Nexium and that sort of thing, just know that your body functions better without them. So if you can find a natural way to fix it, like this, it's a much better option than continuing to give your body challenges at digesting its food, because it needs to be acidic to be able to actually digest your food. So that is our tip. Hope that helps. Thanks for having us on your therapeutic journey.